We reported the QoL result and patient-reported outcome from HERIZON-GEA-01 trial, which evaluated zanidatamab plus chemotherapy with or without tislelizumab compared with trastuzumab plus chemotherapy in HER2-positive population. The primary analysis was already reported, and it showed improved PFS with both zanidatamab-containing regimen, and OS improvement was also confirmed with triplet regimen with zanidatamab, tislelizumab, and chemotherapy. It also showed increased incidence of diarrhea or other GI toxicity. So it is quite important for us to assess the patient-reported outcome, how this kind of toxicity has impact on patient quality of life. And actually, this was one of the secondary endpoint, and we corrected the questionnaire every cycle until 12 cycles, then every 2 cycles afterward. And the overall completion rate of the questionnaire was quite high, so this analysis was supported by robust and longitudinal patient-reported data. And actually, overall patient-reported data and quality of life were well preserved during treatment with zanidatamab. There is some initial decline of scores of QoL with zanidatamab-treated patient, and some increase with trastuzumab-treated patient, but actual difference was relatively small and stayed well below the minimal or smallest reportable change, corresponding to one response level difference in the questionnaire. And importantly, this overall quality of life were improved, especially after cycle 8, corresponding to 5 to 6 months after the beginning of study treatment. And this is also soon after the opportunity to discontinue backbone chemotherapy by investigator judgment. And also, regarding the symptom scales, we see the difference in diarrhea and anorexia at cycle 8 as expected. But looking at time course of diarrhea, initial worsening was observed across treatment group, but it gradually improved over time with small difference after follow-up. And the same is true for anorexia. The actual difference after follow-up is quite small. Regarding functional domain, physical function was well preserved among patients treated with both zanidatamab and trastuzumab, and approximately 70% patients maintained or improved physical function during study treatment. So overall, this study showed significant improvement of PFS and OS with zanidatamab-containing regimen without meaningful deterioration of health-related quality of life or patient-reported outcome. And most of the function and symptom domain are comparable across treatment groups, with a slightly worsening of diarrhea at early time point, which is consistent with the safety profile of zanidatamab, and the physical function was well preserved. So overall, these results support the use of zanidatamab-containing regimen as a new potential standard of care for this population.